I would now like to introduce Maddie, who will be inviting Peter and Olivia to the stage in a moment. Maddie, would you like to share what your competitors from West Region have been up to across this event?
Yes, so last but by definitely no means least, we have Akshita and Olivia, and they are our West Region competitors. Now, they have been absolutely incredible throughout this competition. They both knew exactly what they wanted to choose. They were really good at the start as well as weighing the pros and cons of all the items up. I made a slide, put all of them up. They had a brief discussion, pros and cons, and then go, yeah, this is definitely the one we're going to do. This is what we're going for. And I was like, okay. They made my job so easy as a mentor. They worked so well as a team, and that's definitely something I'm so proud of as a mentor, to see the teamwork that has come out of West Region. I've had other mentors and other people in this competition come up to me and comment on what an amazing team you two have been to each other, supporting one another throughout the competition, and especially yesterday afternoon when it was quite difficult to juggle two regions. You supported each other with not only the team task, but also your individual speeches, and I think that's a massive credit to you both, and kind of the inclusive atmosphere we've made here throughout this competition. So, massive well done to you both. You're honestly amazing. I don't want to ruin what they're going to say because it is really, really good. But well done to you both. I will leave you to it. I will be quiet. I know you've heard from me a lot today. But Olivia and Akshita.
Help.
Hi, I'm Olivia. I'm a first aider. How can I help? Can you tell me what's happened, please? Where does it hurt? Can you tell me how much pain you're in, please, from 0 being no pain at all to 10 being the worst pain you've ever had? What about using these cards? Thanks. I'll get some help. Did you know that there are 3,239,447 people in the UK aged below 5, below the linguistic development milestone?
Did you know 1 in 7 people are neurodivergent?
Did you know that 49% of the foreign-born population do not have English as a first language?
This is why we believe that communication cards can overcome barriers such as age, language, and underlying health conditions. So why do we not have them in our first aid kits?
First of all, who do they help? Well, in one survey, 82.98% of patients agreed that using coloured communication cards helped them communicate with their healthcare professionals, thus showing that communication cards are a clear and straightforward visual tool for, quite simply, ease of communication. Because no matter what your roll bar says, clearer communication is fundamental for safe, effective, and prompt medical care. But perhaps most importantly, they make our treatment more inclusive. They make every patient feel appreciated, listened to, and valued.
So what are the benefits? They are compact, portable, and practical. These cards are very small and won't take up much space in our first aid kits. They won't add much weight either, so no need to worry about added back pain then. Also, they are much cheaper compared to other electronic alternatives, allowing us to invest in a more different range of cards to meet the needs of our diverse community. Also, they are very easy to understand and no technological barrier can block the way for our patients and first aiders.
So some of you may be wondering that in this era of modern technology, why not use an app? Wouldn't it be quicker? Well, we believe our St. John's Ambulance team is diverse, especially in terms of age, ranging from adults like you to cadets like us. And we should all be able to deliver the highest quality of clinical care, regardless of whether we have access to the latest technology or not.
Another drawback could be limited vocabulary. According to the Oxford English Dictionary, there are 171,146 words in the English language, Surely we can't fit all of them in our first aid kits. This is why we would focus on high-frequency words and medically relevant vocabulary. For example, our cards would show emotions, pain score, just like we demonstrated at the start, and key doodle icons. We would also carry around a whiteboard and pen to allow the patients express their feelings through drawing, or modify our cards if they need.
What about the trees, I hear you say? How could issuing a pack of communication cards in every first aid kit possibly be environmentally friendly? Well, we believe that by using recycled paper or other long-lasting materials such as bamboo, we can reduce our negative impact on the environment. We can reduce the water, energy and chemicals in paper production and the cutting down of new trees, thus creating a sustainable, renewable product that also supports the work of St John's Ambulance's Environmental Steering Group.
Now, when was the last time you spilt coffee on all of your work? Yes, accidents can happen all the time, which is why we think lamination for longer life is a great idea. Also, one short payment, our cards range from £5 to £10 per pack, is a small price to pay compared to the number of people it could help, the number of barriers it would overcome, the number of smiles we could put on faces, and not to mention the number of pounds we'd be saving by not choosing iPads. If every first aid kit in St John's had these communication cards, would it not be life-changing? Yes, they are eco-friendly, and yes, they are cost-effective.
But perhaps most importantly, they help everyone feel more included. And surely that's what volunteering is about. So we ask you again, why do we not have them in our first aid kits? Thank you.
So, Akshita and Olivia, first of all, well done.
Thank you.
It's a very big thing for all of our young competitors to get up in front of everyone and share what they would add to an inclusive first aid kit. So I'm going to hand you over to the judges who will share 3 questions with you again, all about your communication cards and why you feel they should be added to St John Ambulance first aid kits.
It's Kevin, and I really liked all of the facts and examples that you had there. Help me understand, is this something that we can just buy because it already exists, or is it something we're going to have to make and come up with for ourselves?
I think it's a mixture of both. For example, we mentioned high frequency words, and for things like that, there's probably packs that already exist. But perhaps for the medically relevant vocabulary, you'd have to work directly with designers to choose what words would be most appropriate for the kit.
Thank you.
Thank you both for a great presentation. So you mentioned medically relevant words or high frequency words. Could you give us a few examples, maybe 3 to 5, of what these words could look like or be?
This could show their feelings, so what they're feeling, say if they're hungry or if they need to go to the toilet for their needs. Those would be examples of high frequency words. And for medical relevant vocabulary, say if they want bandages, that's what they feel is needed, or they don't want bandages because you need to ask for consent, so our cards would cover them.
As well as symptoms that we can't directly see.
Sounds fantastic. My final question for you is, if you had to have a colour theme, would you go for St John colours or would you go for colours representing the emotions?
I think St John colours, for example, green, would be a great universal thing to add because we'd obviously want to branch out wider than emotions, and it would help everyone, including first aiders ourselves, feel more included as part of a team.
Thank you, Akshita and Olivia. If you guys want to take your seats.